Hi, I'm going to go over patient trauma assessment and management procedures. So first, I'm going to take PPE precautions and make sure my scene is safe. Then I'm going to determine my mechanism of injury, how many patients. And then I'm going to request EMS backup if necessary. And I'm going to consider C-spine. Then I'm going to go ahead and give a general impression of my patient. I'm going to check their responsiveness and their level of consciousness. And then I'm going to determine the chief complaint, and if there's any apparent life threats, then I'm going to go ahead and assess the airway and breathing of my patient and give them oxygen at 15 liters per minute. Then I'm going to control anything that compromises the patient's breathing, airway. Then I'm going to check the pulse and skin color, temperature, and condition. Then I am going to control any major bleeding. Then I'm going to position my patient. Then I'm going to take the steps to prevent heat loss from my patient. And then I'm going to make my patient a priority and determine where to transport my patient. Then I'm going to take my patient's blood pressure, pulse, and I'm going to check their respiratory rate and quality. And then I'm going to do sample and try to figure out if they have any allergies, take any medications, if they have any past pertinent medical history, what their last oral intake was, and the events leading to this situation. Then if it's for the head, I'm going to inspect, and I'm going to inspect and palpate their scalp and ears. I'm going to inspect their mouth, nose. I'm going to assess their eyes, and I'm going to check their facial area. If it's for the neck, then I'm going to check their trachea positioning. I'm going to check their jugular veins, and I'm going to palpate their cervical spine. If it's for the chest, I'm going to palpate and auscultate their chest. If it's for their abdomen or pelvis, I'm going to palpate the abdomen. I'm going to check their genitalia and perineum, as well as their pelvis. I'm going to, if it's for their upper extremities, then I'm going to inspect, palpate, and assess motor, sensory, and distal circulatory functions. And lower extremities, if it's for lower extremities, then I'm going to inspect, palpate, and assess motor, sensory, and distal circulatory functions. And if it's for the posterior thorax, lumbar, or buttocks, I'm going to inspect and palpate the posterior thorax, lumbar, and buttocks. And then I am going to control any, I'm going to take care of any secondary injuries. Then I'm going to demonstrate how and when to reassess my patient. And those are the procedures for patient trauma assessment and management.